Did you just throw out your back and you're not sure what you should be doing? In this video, we're going to be talking about what are some of the best things that you can do to start accelerating the healing process for your back so that you can start feeling better immediately. What's up guys, it's Dr. Peter from Motion RX. Today we're going to be talking all about low back pain flare-ups. We're going to be covering what are some of the worst things that you shouldn't do after a low back pain flare-up versus what are some of the best things that you should actually do instead. And finally, what are some of the best movements that you should be doing so that you can start feeling better immediately? All right guys, the first thing that you shouldn't do after a low back pain flare-up is to stop moving completely. A lot of times people think that after a low back pain flare-up, all they should do is just rest. When in reality, the faster you can get therapeutic blood flow into the area, the faster the healing process can start. So after a low back pain flare-up, things will most likely feel very, very guarded and stiff. So if you've ever tweaked your low back, you know exactly what I'm talking about. Your low back will lock up, your hips will lock up, and everything will feel super stiff. And so if you don't move at all, you're only going to add to that very, very guarded and stiff state. Instead, what you should be doing instead after a low back pain flare-up is to start finding different positions that are tolerable, start moving within those different positions. Even if you are only able to find small positions that allow you some relief, stick to those positions that don't bring pain and start moving within those positions again. The earlier that you're able to start moving after a low back pain flare-up, the better. The second worst thing that you can do after a low back pain flare-up is to ignore it. I've seen this so many times before where people ignore it and continue to push into these irritable positions. Pain is really good information from our brain, and we want to use this information to figure out what we can do versus what we shouldn't be doing. By continuing to push into a high pain threshold just because you can, doesn't necessarily mean that it'll be beneficial in the long term. So what you should be doing instead is to modify positions and stick to movements that don't increase baseline discomfort by more than 1 or 2 levels. So what I mean is an example like this. So if you're sitting around a 4 to 6 out of 10 baseline discomfort, try and find positions that don't elicit and spike up pain closer to that 7 or 8 out of 10. Instead, modify positions that don't increase pain or rather feel good instead. We've got so many different positions at the low back that there's most likely going to be some sort of position that feels okay. For example, at the low back, we have bending, extending, rotating, and even side bending. So for example, if bending through the low back is very, very irritable, but extension feels pretty good where you're leaning back, try and stick more into the extension-based positions, and over the course of time, as you slowly start progressing, you can go back into some of the more bending positions again. Finally, the last thing that you don't want to do after a low back pain flare-up is to freak out and rush to get MRI or imaging. You've got to understand and realize that a lot of times musculoskeletal low back pain isn't that serious, and symptoms will most likely resolve quickly over the next couple days if you do the right thing and keep moving. Instead of focusing on what shows up on the scan, rather focus on what your functionality actually is and start focusing on what movements you can do instead. Stay positive and understand that things will trend better over the next couple days. All right, so don'ts and do's of what you should or shouldn't do after a low back pain flare-up. Don't stop moving, don't ignore it, and don't rush to get imaging or freak out. Do keep moving within positions that are tolerable. Do modify positions that don't elicit baseline discomfort or pain, and do stay positive. Oh, and did I mention keep moving? Yeah, definitely do keep moving. That's gonna be the main theme here. All right guys, so we just talked about the don'ts and do's of what you should or shouldn't do after a low back pain flare-up. Now it's time to discuss what are some of the best exercises that you should be doing after a flare-up. So typically when it comes to exercises and movements, there's 2 different buckets that we want to make sure we address. The first bucket is going to be improving range of motion and mobility, and the second bucket is figuring out, hey, what are some of the best ways that we can figure out how to pump some therapeutic blood flow into those regions again. So taking a look at the first bucket of regaining mobility and range of motion again at the low back, 2 of the best exercises for this is going to be 1, a modified cat-cow on our hands and knees, and 2, a side-to-side knee rock on our back. The modified cat-cow on all fours is awesome because it's going to allow you to feel how much flexion and how much extension you can actually push into without exceeding baseline discomfort. So if you've ever seen someone twerk in the club, this is super similar to that as we're trying to separate and dissociate our hips and low back to get some movement independent of each other. So in the cat-cow, as you round your hips and spine, you want to move your head down as you flatten and extend and arch your back as you look up. At the beginning, when it's super irritable after a low back pain flare-up, you can just start out with small ranges of rounding and extending, and as you get more and more comfortable and it slowly starts to feel better, you can slowly increase the degrees of flexion and extension until it's fully restored again. When going through these mobility exercises, we want to manipulate our breath work to help relax our body. Performing some of these movements initially can definitely be daunting at times, as our body may not know whether it's safe or not, so we want to do our best to help downregulate and calm the body down. By exhaling and breathing out when we reach our end ranges of motion when it's a little bit more sensitive, this can actually help us out by trying to calm our nervous system down a little bit more. So when we're going into the rounded position in the cat-cow, we want to take a deep breath in and really fill up our diaphragm as much as we can, and then slowly exhale as you move the other way into some extension. Moving on into restoring some rotation at the low back and the hips, the second exercise, the side-to-side knee rock on our back, is going to be fantastic for addressing this. So what you're going to do, you're going to start on your back and set your feet about hip width apart, and just slowly rock your knees side to side within a range that doesn't exceed your baseline discomfort. So if just a couple inches is all you can get, then that's great. And that's all the range that I want you to move within. So as I rock to my left, I'm gonna get some external rotation on my left hip and some internal rotation at my right hip, and vice versa when I go the other way. As you slowly start to feel better, you'll be able to slowly go a little bit further and further down. So again, if we want to manipulate our breath with this movement, if I'm rotating all the way to one side and I feel a little bit tight and restricted at the very end, that's really when I want to exhale and relax into the position. So if you're wondering, hey, how many sets and reps of these exercises should I be doing on a daily basis? Really, there is no right or wrong answer. You can do as many as you like till you start feeling better. But typically, what I would recommend is anywhere between 2 to 3 sets of 10 to 15 reps is gonna be a great place to start. All right, so now that we've addressed this first bucket of increasing range of motion and mobility again at the low back, we want to start addressing the second bucket of figuring out, hey, what are some therapeutic ways that we can get some blood flow going into the low back tissues again? One of the sneakiest ways to start getting some therapeutic blood flow into the low back early on is to start loading the glutes. And no, it's not because your glutes are weak, but really it's because your low back and your glutes are neighboring muscles that play off each other. And so when we focus on loading the glutes early on, it'll actually take our brain's attention off of being so fixated on the low back pain and start focusing a little bit more on the glutes. And the cool thing is when we typically load the glutes up early on, we'll actually get some indirect loading of the low back tissues as well too. So this is one of our favorite movement variations to load the hips and the low back early on, and it's called the Core 4. The Core 4 is comprised of 4 different banded variations, and the first one is a simple banded glute bridge. So this is going to be a great option to start with, as it's going to allow us to start getting some light blood flow into the hips and the low back. What you want to do is to grab a band loop and get it around your knees and start on your back, set up into a 90-90 angle on your back. From there, we want to get our feet hip width apart and push out against the band with our knees. When we push out against the band with our knees, we're activating our lateral hip tissues. So right now, the brain recognizes that our hips are being activated, and it'll take its attention away from being so hyperfixated on the low back. From there, we want to keep our toes down and slowly drive through our feet while keeping our shoulders down and lift our hips up. When lifting our hips up towards the ceiling, we'll slowly start to activate not only our glutes, but most importantly, the extensors and erector muscles in our low back. The higher we drive the hips up, the more erector low back muscles will activate and use. So at the beginning, it'll be super common for someone who's flared up to only be able to lift up maybe only a quarter or half of the way before reaching their sensitive threshold. And that's okay, because you move within what you're able to move through, and as you slowly improve, you can slowly increase the range as the back progresses. The second exercise in our Core 4 is going to be a side plank on the knee with a banded clamp. This is going to be awesome because it's going to target the lateral hip and the side oblique, and it'll allow us to start unilaterally loading the back one side at a time. So what you're going to do, you're going to keep the band around the knees, and you're going to set up on your elbows and knees. And you're going to stack your elbow directly below your shoulder and bring your bottom hip up as high as possible. From there, you want to keep your feet together and open up the top hip. You'll feel both the top hip and the bottom hip working, with the bottom hip being the one you should feel fatiguing the most. The third movement in our Core 4 complex is going to be an all-fours fire hydrant. Yep, you guessed it. You're going to set up like your favorite four-legged friend marking his or her territory on the neighborhood fire hydrant. So we still have the band from our first 2 exercises, and what we want to do next is we want to set up on our hands and knees and bring one knee and foot all the way out to the side and back in. With this one, you're going to feel the hip that's moving away as well as the hip that's staying still on the ground as well too. Finally, the last one in our Core 4 complex is going to be a banded side step. This one's awesome because in addition to the booty cheeks working, you also get to play around and tease out how much of a hip hinge you can slowly start to tolerate at the low back. So we still have the band around our knees from the previous 3 movements. We're gonna keep it there. What we wanna do is we wanna get into a nice athletic stance position with a soft bend in the knee and just a little bit of a hip hinge. You wanna play around with how much of a hip hinge you can tolerate. At the beginning, it may be irritable to hinge a lot, so you may want to stay a little bit taller to start. As you progress, you can slowly start to hinge and bend a little bit more through the back during this movement. Play around with what feels comfortable. So, as you have the band around your thighs, with a soft bend in the knees and hips, we want to take a big step out with our lead leg and take a small step in with our trail leg. A common mistake we'll see people making with this banded side step exercise is that they'll bring the trail leg in all the way. You don't want to do that. You'll take complete tension off the band. Rather, you want to take a big step out and a small step in so that you're keeping constant tension of the band and making sure the hips are working the entire time. What you'll do is you'll go big step, little step, all the way down and back. So with this complex, you want to run it probably about 2 to 3 times as a circuit to really get your body going, and hopefully you break a nice little sweat. So you're going to go banded glute bridge, side plank on your knee with a banded clam, banded fire hydrant, and then a banded side step, and then you're gonna repeat all of that 2 to 3 times. Anywhere from about 10 to 15 reps each is gonna be a really good place for you to start. So these movements in the core 4 are all gonna be fantastic variations to start driving some therapeutic blood flow into the low back region again in order to start getting you to feel better. Pair this with the 2 mobility exercises that we talked about at the beginning, and you're gonna be in a really good place to start getting your back to start feeling better, kickstarting into the right direction again. So what you wanna do as you slowly start getting better is start adding in some larger compound movements that address not only the back, but also the entire body. Things such as squats, deadlifts, RDLs, and other hip hinge variations are gonna be fantastic ways to start building up your back again. These movements at the beginning are gonna be a great place to start, but it's not the end all be all. So make sure you don't just stop there. So I hope this video kickstarts your recovery in the right direction. If you found it helpful, please share this with another friend who may potentially be dealing with low back pain. Make sure you like, subscribe, and we'll see you guys in the next video.